Now to the latest on the coronavirus here in Connecticut. A new COVID-19 antibody study was done on Hartford HealthCare employees, and now the results are in. Dr. Pavlos Papasavas joins us now from Hartford. He is the Director of Surgical Research and a bariatric surgeon at Hartford HealthCare. Thank you for taking the time to chat with us, Doctor.
Thank you for having me.
Well, it's a pretty exciting day here in Connecticut for you, right? The data from this antibody study has been released. So what did you find?
We're very pleased to announce the results of the first phase of our study. We tested 6,865 healthcare employees in our healthcare system, and we found that the rate of antibody detection is 6.4%. If you compare this with the state study performed by CDC, it is very similar. They did a similar study of 5,000 citizens of Connecticut in 3 phases, and the latest rate is 6.3%, so very similar to our rate.
So what do these results mean for the general public during this pandemic?
It means that the healthcare employees have done a great job adhering to the PPE policy, protecting themselves and the patients that they care for. But it goes beyond the hospital. When they leave the hospital, they follow the guidelines from the state of social distancing and protecting themselves. And this is how we have a very low rate in Connecticut. So right now it is very safe to be hospitalized if you need to receive care in one of our hospitals because the rate is very low.
That is some good news. Obviously, a lot of people are a little nervous entering the medical facilities if they don't have to go, for even just routine checkups. How will this information help not only the public, but healthcare workers in the future?
The second phase of the study will happen in November. We are going to invite all the healthcare employees who participate in the first study and retest them with another antibody test, and see how many of them still have a titer of antibodies at 6 months after the first detection. And that is useful information. There is some data that indicate that the antibody titer may fade away with time, and this is something that we're very interested in investigating further.
And one more quick question, Doctor. Do you know of any other hospitals in the country doing a study like this on their healthcare employees?
There are a few other healthcare systems that have performed similar studies. Northwell in New York and Beaumont Health in Detroit. In New York, the results were similar to ours. Their detection rate was 13% versus 12% in the population of New York. So about 1% difference from the public, something similar to ours.
Well, it's always nice when the numbers are kind of lining up in the same ballpark. Dr. Papasavas of Hartford HealthCare, thank you so much for this latest information.
Thank you.